All right, then we'll go ahead and get started. Thank you all so much for joining us today and learning more about reproductive justice as a part of our Levántate y Lucha programming. My name is Marta Reina, and I'm a regional organizer for the San Antonio region. And we'll go ahead and continue on our next slide and let you know a little bit more about our intentions for today. So we welcome all levels of knowledge, and we want to make sure that this is a safe space for growth. We ask that you please stay muted during the presentation, but we encourage participation in our mentee questions. We will have a Q&A at the end, and we encourage you to use the chat to ask questions or raise your hand to go off mic. So at this time, we would love if you can introduce yourself in the chat with your name and the city you reside in. Awesome. I see Austin, DFW, San Antonio, Houston, Dallas, Austin, Houston, woo woo, San Antonio, Brownsville, ooh, love it. Houston. Alrighty, we got a good amount of responses, so we'll go ahead and we'll get started and we'll continue on. So today we are honored to have an invited facilitator from our beloved partner organization, Deeds Not Words. Jocelyn is a relentless advocate for reproductive rights and healthcare autonomy. Jocelyn's journey from student leader to legislative advocate reflects her dedication to empowering communities and future leaders. Can we show some virtual love to Jocelyn Sanchez in the chat?
Hey, y'all. Firstly, thank you, Martha and Joel team, for having me. I love each and every opportunity I get to work with this organization. But yes, my name is Jocelyn Sanchez. I'm the Policy and Advocacy Manager with Deeds Not Words. I'm based in Austin, Texas, and really excited to talk with y'all about reproductive justice and where we move forward here in Texas.
Yeah, we're super excited to have you. Now, I did mention earlier that this is a Menti presentation, so we'll go ahead and talk a little bit more about getting registered through Menti to make sure that you're able to participate. So as we expand our knowledge today, we want to recognize what we already know. So during this time, we ask that you join us by going to menti.com and use the code at the top of the screen. The code is 78821204, or you can use the QR code to join. Once you have joined, can you type in the chat joined? I think we're waiting on a little bit more people to join in. Alrighty, I think we're all good. So now that we have that set up, we can go ahead and jump into our first question. So for the next slide, we want to know, what does reproductive justice mean to you, and where have you seen it in your life? And keep in mind, all responses are anonymous and everyone has different experiences. So we'll give it a couple moments here for people to go ahead and respond. My future, healthcare, birth control. Okay, I love those responses. Fairness. See it everywhere. Access to healthcare, taking care of myself, bodily autonomy, equality. A lot of words I'm seeing here that are are good words and descriptors. Let's see here. See it everywhere. Control, independence, my future, empathy, empowerment. Yes, thank you so much for being vulnerable, but also sharing these words, terms, or anything where you see reproductive justice all around. Necessary. I love that one. Necessary. It's definitely necessary. All right, and I think that's pretty much all of our responses that we've reviewed. So we'll go ahead and go into the learning portion with Jocelyn. So we can go to the next slide.
Awesome. Yeah, those answers were very amazing. And I love how none of them really focus on like political terms. They were all just terms that enrich our livelihoods, like healthcare, access to it, being able to be independent, and things related to that. So I'm really excited to kind of give us some context into the position we're in here in Texas and also nationwide. So kind of talking about what abortion is and where we started. So basically, abortions always existed. Research shows in medical journals, some of the first medical journals, even from the 1700s, document cases of midwives and nurses practicing and administering reproductive care like abortions. The United States began making laws around the 1800s, but we already found that those laws, even from the beginning, were insufficient to actually even stopping abortion, because we know that once restrictions are made around abortion, it doesn't stop abortion in its entirety. What it does is it stops safe abortions. So from that time that states began making restrictive laws, we saw that people were seeking care more covertly, which is when what we call back alley abortions started happening, which are technically unsafe abortion procedures where we see folks having to go out of their way, maybe to unqualified professionals, but in desperate need to get the health care that they need. Um, then we move to modern day laws. So I'm sure we've all heard the term or the case of Roe versus Wade. That case actually originated in Texas. Fun fact. So what we say is that Texas is essentially the testing ground for bad abortion laws and honestly bad laws in general. Um, so the 1960s gave rise to abortion law reform. In the late 1960s, 11 states liberalized their abortion laws. And in 1973, the Supreme Court established the legal right to access abortion nationwide with its landmark decision in the Roe versus Wade case. Ultimately, what this decision came down to is your right to privacy about your health. However, due to systemic racism, laws restricting access to abortion continue to target Black people and other people of color, especially in underserved areas, including Latino populations. A specific law was the Hyde Amendment. This amendment specifically bars Medicaid dollars from being used to cover abortions. And we saw, since that amendment happened, communities of color being affected nationwide. Then we go to 2022. In 2022, what we had was the Dobbs decision. The Dobbs decision basically was Dobbs versus Jackson Women's Health Organization. I believe this case was out of Mississippi. It was a case involving a challenge to a Mississippi ban on abortion at 15 weeks of pregnancy. Ultimately, the ruling of the Dobbs decision overturned Roe versus Wade. So it overturned what we had historically access at minimum to abortions, even though states had specific restrictions and regulations. Dobbs kind of destroyed all of that and made states be able to challenge abortion laws. So what happened with the Dobbs decision in 2022, once the Supreme Court ruled, Texas specifically already had a trigger law prepared. So that trigger law went into effect, effectively banning abortion and making abortion inaccessible in Texas. So the abortion bans that have taken effect since June 2022 have inflicted harm on Black, Latino, Indigenous, and other communities of color, communities where systemic racism has long blocked access to opportunity and healthcare. And then we know that Texas also has specific restrictions. We know that because of the Dobbs decision, states are different and get to choose what their abortion restrictions look like. So in Texas, we have a unique history around abortion access. Like I said, Roe v. Wade originated in Texas, but moving to more of the modern cases, in 2003, Texas passed the so-called Women's Right to Know Act. The law mandates that doctors give misleading information about the abortion procedure to the patient and provide alternatives to terminating the pregnancy. Ultimately, this law, the Women's Right to Know Act, is just a way to guilt trip people into changing their mind about abortion, and also does some very traumatizing things like require the person carrying a child to listen to sonograms and basically have a hold on them before they get to make the decision ultimately about whether or not they want to have an abortion. But in 2021, we had various laws passed after that, but in 2021, the state legislature passed Senate Bill 8, a law that bans abortion as early as 6 weeks in pregnancy. Make note that many people don't even know that they're pregnant at the 6 week mark. Which is why this law effectively eliminates abortion access in the state and imposes an unconstitutional ban on abortion. This unprecedented law also authorizes private individuals to file civil lawsuits to enforce the abortion ban. So this part of the conversation is very important of the enforcement of the abortion ban. The way the law is written is that it doesn't target the abortion seeker themselves. It targets the community around them. Basically, if you aid and abet someone seeking an abortion, in terms of maybe you're transporting them in the car, maybe you send them resources, maybe you are the medical provider. Those are the people that are most at risk. So we see Texas kind of targeting our communities and the concept of community care in that way. And I don't know if we saw recent headlines, but there was headlines about Ken Paxton recruiting boyfriends, husbands, to report their loved ones in attempts to seek abortion care. So we see that they know and they have an understanding that community care works and is effective, which is why they write laws in this way to target those aspects of community care. We also saw this specifically in Amarillo, where we saw right-wing folks out of state groups come into Amarillo to attempt to pass essentially a travel ban on people seeking to go out of state for abortion, because we know at this point, most people can only rely on out-of-state alternatives. But thankfully, that travel ban was voted down by voters in Amarillo, which was a very big win for reproductive justice in Texas. But I believe we're going to continue to see more efforts to break apart our communities, because they know how much potential communities have when we stick together. So we're seeing all these attacks, but we're going to continue to move forward in talking about reproductive justice and how we can get involved and make an impact as well. So I'll pass it back to you, Martha.
Thanks. And then we'll go ahead and go into our second mentee question. So we can go to the next slide. Our next question is, what did you know and what did you not know and what did you already know? So it'll give you enough characters for you to give responses for both. And I believe you can answer more than once. And once again, these answers are anonymous. So we'll give it about like a minute or two for people to respond. Dobbs case, okay. I didn't know about recruiting loved ones to report on people. Now, that was fairly recent, too. Roe versus Wade was in Texas. Texas started this first. Dobbs, and then Roe versus Wade, the cases. I didn't know that the ban is also affecting people who help people wanting abortions, even just giving them information or helping them get where they need to be. Yes, and I think this past week as well, there was a doula in I believe, the Houston area or Dallas, in Texas, who is already being getting like in trouble for assisting with uh, assisting with an abortion. And then the fact that Texas went along with this, I didn't know about the Women's Right to Know Act. I didn't know about Paxson was asking families to report each other wanting an abortion. I didn't know about the Amarillo vote down. And it's super important for us to be more aware of the things that are going on, because then we can speak on why these things shouldn't continue and advocate more towards those. We'll give it a couple more seconds. Alrighty, then we'll go ahead and go on and move on to our next slide. So we're going to talk more about culturally, what has the discussion look like in our communities? So harmful stigmas around purity that are imposed on young individuals who may become pregnant. As a young Latina, I was told a story that I needed to wait before marriage to have sex. And recently I had a conversation with my mom, uh, asking her like what kind of talk she received from her mother because of this presentation, and she let me know it was the same abstinence conversation. So this is a cycle that continues from generation to generation. And looking back, what I truly needed was an honest conversation around sexual education and protection. Conservative and religious values can lead to shaming, and that can create barriers to receiving abortion health care or having conversations about it. So, in a study conducted in 2013, surveying 78 people who have had an abortion, they found individuals experiencing religious informed abortion stigma is typical for US abortion patients, even when they claim no religious affiliation. So as a Latin community, we should focus on the community pillar of a strong family dynamics by providing support for the people we care about that seek abortion care. In one of the previous reproductive justice webinars I've attended, they shared something that I found most impactful and was encouraged to share with people when talking about abortions. Someone you love has had an abortion. This can be a friend, a colleague, a coworker, or a community member. Some may share and some may not, but that doesn't take away from the fact that they received the health care that they needed. The societal expectations of women becoming mothers. For example, how many times have you gone to a family event and your tia asks, ¿Y cuándo vas a tener niños? Raise your hand, like if that's happened to you, or when are you having babies? Becoming a parent is a major decision, and we must respect a person's choice. And then lack of conversations around sexual health and pregnancy prevention, both in Texas educational systems. And so a study by the Texas Freedom Network in 2017 found that 58.3% of schools in Texas took an abstinence approach to sexual education. 16.6% taught abstinence plus curriculum, and 25% taught no sex education at all. So undocumented women in border towns may face feelings of isolation when making their choice to an abortion due to checkpoints they may need to cross into states like New Mexico, Oklahoma, Louisiana. The Latina Institute reminds women of the Rio Grande Valley that they're not alone to prevent from resorting to risky alternatives to abortions or like home remedies that may put their health at risk. So now that we reviewed culturally how that discussion looks like, we'll let Jocelyn explain more about abortions.
Yeah. So the best way to frame abortion when we discuss abortion with friends, families, peers is to say abortion is healthcare. That is a definitive fact. It is observed as healthcare from the World Health Organization, WHO, and the National Institute of Health, both two of the most reputable health organizations, especially to us in the United States. But abortion and access to it can look like various things. It looks like a reaction or procedure needed because of a miscarriage. It may look like something you need because of a sexual assault. And it also is just services for anyone that no longer wants to be pregnant. And that can be for a variety of reasons. One of the best cases that is an example of affirming abortion as healthcare is the case of Amanda Zarowski. She's a plaintiff from Austin, and you might have heard the case of Zarowski v. Texas. Basically, what happened is she had preterm labor rupture at 18 weeks. She went to a Catholic hospital in Austin where they denied her an abortion because doctors said they could still detect fetal heart activity, although the baby was already in distress, she was already in danger, and her livelihood was at risk. 3 days later, she showed signs of infection and was diagnosed with sepsis, a life-threatening condition. Although doctors then performed an emergency induction abortion, she spent the next 3 days in the ICU fighting for her life. She ultimately survived, but the infection caused one of her fallopian tubes to become permanently closed, compromising her future ability to have children. She has been forced to turn to in vitro fertilization in an attempt to start a family. But now that we know that there's abortion restrictions and abortion is questionable nationwide, even IVF is at risk. Although conservative talking points say that they affirm IVF and people's choice in choosing that method to start a family, immediately once the trigger law went into effect in Texas, people found that their embryos were at risk, people that were in the process of IVF treatments as well. So abortion restrictions not only cause a stigma in receiving the care people need, but it also limits care drastically and the access to care. Studies by the National Institute of Health show that even when abortion is legal in a state, services are hardly available. They found that less than 20% of OBGYNs in a given state where abortion is legal, only less than 20% of OBGYNs are even able to perform abortion services. All of these circumstances are even more serious in Texas, with rural regions lacking any form of reproductive care, now more so in an abortion ban. And rather than reforming women's health care, Texas lawmakers seek to instill fear and stigma with more bans. Women's health care in Texas is in danger. Almost half of all Texas counties offer no maternity care services. I'm going to say that again to emphasize it. Almost half of Texas counties offer no maternity health care services. More than a quarter of rural mothers live more than 30 minutes away from the nearest provider. Living in a maternity care desert contributes to delayed prenatal care, increased pregnancy complications, and worse delivery outcomes. Women living in rural areas are more likely to die from pregnancy or childbirth-related complications, and infant mortality is also higher. Despite these sobering statistics, more rural hospitals are closing their labor and delivery units for funding reasons. They're not able to staff or fund these emergency rooms because of a lack of state and federal funds. So they're closing. And most of these situations where labor rooms are open, due to low Medicaid payments and too few deliveries to break even on costs, these maternal units are still closing. So all of these things kind of affirm abortion as healthcare. And the reason we need to frame it as such in these conversations is because we need to realize that when something is related to healthcare, it not only is a private individual choice between someone and their healthcare provider, but at times is also a life or death situation. I know we've seen, especially in the news recently, of people that we're finding since the Dobbs decision in 2022 have died because of abortion restrictions, not only in Texas, but mainly across the South, we see. So this is why it's important to affirm abortion as healthcare. Our healthcare providers believe it's healthcare. Studies and academic institutions know that it's healthcare. We need to talk about it within our communities, framing it as healthcare. And we can also go to the next slide. So these are other aspects of our health and healthcare that fall under the umbrella term of reproductive justice. So think about condoms, menstrual products, general gynecology care, pregnancy care, access to prenatal products, birth control methods, sexual assault resources, and HIV testing. All of these are under the umbrella of reproductive justice. But when one domino of reproductive justice falls, we see that the others fall as well. So, for example, now that Texas is in the middle of an abortion ban, we're seeing that now, especially with the legislative session, there's proposals for bills that would limit our access to things like emergency contraceptives, Plan B for people under 18, which we know that contraceptives and preventing pregnancy should be a priority in a state that advocates against abortion, and yet they're trying to remove all the other alternatives from abortion as well. So this is another reason to affirm abortion as healthcare so that we can also have access to these services. We've also seen things like funding for HIV prevention is also being cut federally, or has the potential to be cut federally. So more of a reason for us to continue to keep advocating to not only keep our communities healthy, but to keep them safe and also protect their constitutional rights to privacy in their healthcare. I'll pass it back to you, Martha.
Alrighty, now we're gonna go ahead and go into some myth busting in our next slide. So with the already lack of research around women's reproductive health, there comes myths around the topic. So here are a couple of explanations that we're providing at proving wrong today. So the first one is tampons take away your purity. This is false. Tampon shaming exists in many forms, but we should not impose this on others, especially if it creates a barrier to a person having access to an available menstrual product. You can't go swimming on your period. This is also false. Period products like tampons, menstrual cups, or period swimwear will stop any leaks while swimming. This is advised to change your product before and after you swim. So using birth control is only for sexual activity. That's false. Birth control pills are used for various things like regulating menstrual cycles, treating PCOS, endometriosis, acne, and alleviating perimenopause symptoms. Taking advantage of abortions or late-term abortions. So late-term abortion is not a medical phrase and does not exist. We should trust people and their doctors to determine when they should receive care, especially during a high-risk pregnancy. And our last one is reproductive justice does not include miscarriage care. That is false. Reproductive justice extends to all facets of reproductive life, and that includes miscarriage care. And this will lead us into our next Menti question. And on the next slide, have you heard of any other myths or something similar to these examples? We'll give it a couple of minutes here for people to respond. Tampons make you lose your virginity. Okay, yes, I've heard that. Yes, the tampon myth was something my mom told me and my sisters. Yes, same.
Same.
Tampons get lost inside you. I've heard that one. Stigmas that being on your period makes you gross or unclean. Yes. Heard the same thing about birth control, but it's actually beneficial to other things going in your body. Yep.
Mhm.
It helps, like, I think with hormone control as well, too.
Yep.
Only on birth control because you're sexually active slash not for other reasons. Yeah, I've heard that. Didn't know about birth control one until after I got on it.
Yeah, and I think all of these points really emphasize why we need to have these discussions now more than ever. Because something as simple as talking about a tampon and how our menstrual cycles work and how birth control works, ultimately what it leads to is a conversation about reproductive justice, which is conversations that we really need to have.
Didn't
Didn't
know.
know birth control was good for perimenopause. Yeah, awesome.
Yeah, I think we can go ahead and continue on. So we'll go to our next slide. Now, what we're going to do is what we call a vibe check. This is like a content pit stop to see how everyone's feeling. So we just want to make sure we take a moment to acknowledge those feelings. So I created this little graph here with different emotions. So what you can do is you can drop a pin on the emotion that you're most gravitating towards right now based off of the content. Okay, I see a dot ready to take action. Love it. Inspired. We got two dots under inspired. More aware. I love the glasses. Look, I think I'm just biased because I have glasses. Let's see here. Empowered. Yes, we want to empower ourselves, but also we are part of a greater community, so we empower others. More aware, empowered. We'll give it a couple more moments here for other responses. Ooh, Beverly, I see here in the chat, educated. Ooh, I love the book. Someone put a book, so for want to learn more, love it. A fire, inspired. Love it, love it, love it. I see some more in the chat. I love this. I saw another ready to take action in the chat. Yay. It's a good thing you're part of this webinar and you're part of our movement because we need more people to take action and deeds not words as well. Ooh, I got a megaphone ready to speak out. Yes, I love this. Alrighty, so now that we kind of see how everyone's feeling, we'll go ahead and turn our attention to our last Menti question. So it's, how have you ever had trouble getting the healthcare you needed? So have you ever had trouble getting the healthcare you needed? We'll give it a couple moments here for people to respond. My friend needed an abortion in high school, wouldn't be possible at all today. Yes. Yes, it took me 10 years to get diagnosed with PCOS because my doctors didn't believe my symptoms. Yes. Even then, having those kind of like conversations with your gynecologist, like sometimes they just like push away from like even talking about that. Like, especially I had asked my gynecologist once and they told me that because like I wasn't planning on having children, like they wouldn't further see into it. Like it was crazy. Healthcare marketplace makes it hard to know what will be covered. Yes. So yes, you've had trouble getting healthcare you need. Just finding a gynecologist at all, even with insurance. Yes. Not me, but my cousin is very outspoken about a miscarriage she had. She went to the hospital to receive care and they turned her away, said there was nothing they could do to help her. Oh, thank you for sharing her story. But yes, it's very unfortunate these times where the abortion has existed for so long, yet we are now legally making it impossible for people to receive health care. Let's see here. Finding good OBGYN in Texas is hella hard. Yes. And it's so true about like some of I'm from like the hill country part of like San Antonio, like everything is like a commute. So imagine people who don't have transportation or getting those appointments to get to those places. I had trouble due to cultural stigmas. Finding a Black or Latina OBGYN, yes. Finding a good doctor to hear your concerns and actually take action on the concerns you have are rare to find. Yes, this one. I felt that one. think we're good on responses. We can, let's see. Oh, here's one more. Access to a low cost gyno without insurance. Had to deal with my pain and period issues. Lack of education in school slash parents making it difficult to navigate who to talk to. Yes, all of this. And, we shouldn't be having to face these barriers, especially to receive healthcare. And then I want to thank y'all for these honest responses, especially for this question, because these are the ones that we should be having with one another. And this goes like beyond genders. And then my sister began her cycle super early with other related symptoms. It took my mom forever to find a doctor that would even listen and take care of her. And it's not like school teaches us any of this period. In creating this, I had conversations with the other organizers, and we talked about like our experiences like in the healthcare system and like what was the talk that we had, and it's not really very much in depth. But thank you so much for all these responses. We'll go ahead and go into our next slide, and we'll let Jocelyn talk a little bit more.
Yeah, I wanted to make sure we walked away from this conversation with also some Spanish resources because I know that some of us have very mixed families when it comes to what language we speak. And with Jolt having a very heavy Latino audience, I wanted to make sure that we share these resources so that we know also how to have a conversation, even in Spanish, about reproductive justice and access to abortion. So especially don't worry about keeping this information right now. It will be sent to you as well with a more thorough list of resources that are also accessible in English and Spanish. But el aborto es una parte normal del cuidado de salud y de la vida de muchas personas sin importar su origen o creencias. Apoyamos a nuestras familias, vecinas y amigas en sus decisiones. Tomar estas decisiones es un acto de cuidado, amor y responsabilidad, algo que todos deberíamos apoyar. Y también el acceso a la atención médica de emergencia, EMTALA. EMTALA refers to your ability to access care even in emergency situations, regardless of insurance or your ability to pay. Emergency rooms will and are legally obligated to admit you. Under EMTALA, which is something that a lot of Spanish speaking communities don't necessarily know or are aware of and make them more afraid to seek care, but is important to emphasize. And also, if my friends that are helping us in the chat could share the one pager that includes the Repro Legal Helpline. And that phone line is accessible in English and Spanish, and I believe also Mandarin. So please check out that doc with that's been dropped in the chat with all of these resources. But I really do want to emphasize that we need to be having these conversations. We can't just keep these conversations to ourselves, to our peers that we know have the same, whether it's political or moral views as us. We have to have these conversations with our families because, like I said in the beginning, they are coming after our communities through our support systems. They're asking boyfriends, fathers, husbands to basically rat out their loved ones that are seeking healthcare. So if they can target our communities, we also need to make sure that we build even stronger communities so that when instances like this happen in an attempt to break us apart, we know that they'll fail. I think that the Amarillo case is an exceptional point to this. When it came to a vote, a popular vote of saying, hey, do we want a travel ban? Do you want to rat out your neighbor and be able to report your neighbor or community member for going out of state for an abortion? And Amarillo said no. And that's kind of a sign to say, our communities say no. Our communities say no to fighting against each other in reporting each other for abortion bans. So although these conversations can be uncomfortable, especially with loved ones, which I know we've probably all experienced, they're important now more than ever. So we have these Spanish resources. Please share them, even if it's like dropping the link on your story from the document of resources. They are very important to share. But I'll pass it back to you, Martha.
I can go ahead and take the next slide to provide more of the information in Spanish. Tienes derechos a recibir atención médica de emergencias sin importar las leyes de aborto. Tienes derecho a rechazar intervenciones médicas y decidir qué información compartir sobre ti. Leyes sobre el aborto en Texas, vamos a compartir. Y luego las leyes actuales prohíben el aborto en casi todas las circunstancias, pero existen excepciones en emergencias médicas que amenazan la vida o la salud de la persona embarazada. So then we can go ahead and jump in more into local efforts, which will be in our next slide. So I'm going to talk a little bit more about the San Antonio Reproductive Justice Coalition and bring awareness to it. In 2023, the city of San Antonio created the San Antonio Reproductive Justice Fund. So this accomplishment is credited to the following organizations: Sueños Sin Fronteras, Lilith Fund, Buckle Bunnies Fund, Avow Texas, and Jane's Due Process. Since then, the fund has provided access to reproductive and sexual health resources such as pregnancy tests, emergency contraceptives, menstruation products, prenatal vitamins, at-home STI testing, doula support, and logistical support for people seeking out-of-state abortion travel. So the support of this fund is crucial to the city, especially with the spike of sepsis rates during pregnancies and the fact that 35,000 patients left Texas to obtain an abortion in 2023. And now I'm going to say that one more time: 35,000 patients left Texas to receive healthcare somewhere else where they should receive it here. In 2024, the city failed to renew the budget, but the coalition continued to speak out at council meetings and encouraged constituents to send out letters to their respective council members. So this year, the Community Health Committee moved forward with providing the additional funding. So I just wanted to share that little win here. And I'll let Jocelyn talk a little bit more about the Amarillo case.
Yeah, y'all might be wondering why I keep bringing up Amarillo, why it's so significant, but I can give you a little bit more context. So, for one, these pushes against abortion access have been planned and thought out for a very long time. Even since Roe v. Wade, there have been political strategies in place in order to try and reverse Roe versus Wade, which is what we saw in packing the courts and packing the justice system, and ultimately resulting in the Dobbs decision, which again overturned Roe v. Wade and our access to abortion. So, in these calculated attempts, also includes local efforts. Basically, we have Jonathan Mitchell and some other folks that advocate or present themselves as sanctuary cities for the unborn, is what they call their local efforts. They are out of state folks that come into small rural towns in Texas and attempt to get them to pass a travel ban. They call it a sanctuary city for the unborn, but basically what it is it gives authority, again, in that same kind of vigilante aspect of reporting loved ones. It also gives authority to local police departments to be able to fine and jail anyone seeking to go out of state for abortion services. So they attempted to pass that in Amarillo. It did pass in more local small towns, but Amarillo was one of the bigger towns that they attempted this in, and it failed. And it failed by a lot. And it kind of showed the conservative push that communities aren't just going to let this slide by. If you have a chance, go look on Instagram at Amarillo Reproductive Freedom Alliance, or ARFA for short. I just know them as ARFA, but find them on Instagram, check out their content, and they have documented along the way how they fought against these efforts. But they are a great organization that we want to model and replicate as we continue to advocate for reproductive justice.
Alrighty, and I can talk real quickly for our last point of the abortion funds in Texas. So here's a couple that we're mentioning. Jane's Due Process, so they help people statewide, and some of these organizations also like me answer any questions for people. Frontera Fund, they work from 100-mile radius of Texas slash Mexico border. How it's explained to me is anything San Antonio below. The T Fund is statewide as well, and Afaya Center, they have a fund and it's called Support Your Sister Fund, and that is statewide. And the focus is to help the Black community in regards to like people who are seeking abortions. But we can also provide that information as well, part of the in our email and that one pager that we'll be sending out. So we can go into our next slide. And now what can we do to help? So únete a la lucha. So rally for RJ. So write a letter to your representative. Tomorrow I'll be going to the state capitol. So you can write a letter to your representative, and it can look something like we want you to listen to the people. Our community knows that exceptions do not work, and access to safe and legal abortion is essential, and we demand that our elected representative protect this right. So we'll also be including that there, and I included my email there as well. So if you want to send it to me before the end of today, or if you have any questions and need more help with that, I'll make sure I put my email in the chat, and I'll let Jocelyn talk a little bit more about their initiatives.
Yeah, we have a Deeds Advocacy Day with a local Austin organization called Democracy. We'll be going to the Capitol to have some workshops about reproductive justice and to keep us up to date and informed on new laws that have been filed in the legislative session. Again, it does take a while and a process. We're still moving through the ledge and trying to see where these laws go. But the Attorney General and the governor and lieutenant governor have released priorities for this legislative session. Some of those do include what they are calling exceptions to abortion, but what we know are just further restrictions and further barriers and hurdles for us to have to jump over in order to get the healthcare that we know we need. So we know that exceptions don't work, but we have this advocacy day where we'll be going to the Capitol, doing office visits, and also enjoying our time and building community at a local fun LGBTQ friendly bar. It's called Cheer Up Charlie's, and Democracy will be hosting us there because we know it's important not only to do the hard stuff of the policies and office visits and writing letters, but also to build community in that way. So we'll be doing that. And also keep an eye out for our Action Network letter campaign that we'll be releasing soon around House Bill 3769. This is an amazing bill written by Representative Police's office, but also in support of our students. This bill is to ask our representatives to fund and support accessible emergency contraceptives on our college campuses. What this can look like is vending machines providing things like Plan B and Julie at cost, not at the $50-$60 mark that we know it costs at the store, without having to bother our lovely Walgreens employees to unlock the Plan B for us, which is an annoyingly awkward situation. It should just be accessible. So that's why we have HB 3769 to make sure that we have resources like emergency contraceptives available and accessible to our youth that is at a cost that is reasonable. But yeah, we can go to the next slide. Awesome. So here's a further list of these resources. The @ are our Instagram handles to different organizations. And I'm going to share my screen real quick to walk you through this virtual card that Deeds created. So this is some resources that were compiled at Deeds Not Words. And this card is super awesome. It's just a very short link that what I like to do is I like to put it as the link in my bio so that if friends or family need to access it, they know it's always going to be there. You can find hotlines, access to contraceptives. You can also find, what are the laws right now, resources for parenting, education, and also know your rights. So each of these things you can click and you can find more links within it. It lets you know locations of where services can be found and located, and also links you to organizations that are doing the amazing work that we need. We have some important hotlines as well: suicide hotlines, talk lines, counseling resources. We have the amazing JDP phone and text line, even after abortion support, the Repro Legal Health line. So all amazing stuff. Definitely take advantage of it. We dropped the link in the chat as well. Like I said, the easiest way to share it is to maybe make a Facebook post or an Instagram story and just say, hey, I have this link. You never know who might need it. Just share it that way. Makes it easy peasy and super accessible to your community.
Awesome. We also have some of the Instagrams for the organizations and the abortion funds that we've mentioned. So I can also drop that in the chat. But we want to reserve time to make sure that we answer any questions. So we'll go ahead and go to our next slide. We do want you first to take a quick survey just so we can kind of know a little bit more about how we did today. So if you could go ahead and either use this QR code, if not, we're also dropping the link in the chat. It should take about 2 minutes for you all to fill out. And it should be really quick. So now that we have that link there, we can go to the next slide too, just so you all know that we have our Q&A next. So if y'all have any questions or anything like that after taking the survey, you can put them in the chat, or if not, raise your hand and go off mic. Said Jocelyn would be able to provide more information or clarification on any questions that you may have.